story made national headlines. It was a motorcycle accident that almost took his life. Brandon Levine spent a month in a coma, and then he faced months more of grueling rehab, some of which has brought him from his home in California to expert doctors here in Maryland. Brandon and Dr. Ryan Katz with Curtis National Hand Center at Medstar Union Memorial Hospital are joining us this morning to talk about this. And I just want to say I'm glad you're here to be able to talk about this with me. I'm sure you are too.
Me too.
Tell me about the accident.
Well, it was last year. I was on my motorcycle. Basically what happened was I ran off the road. We're not really sure how it happened. I ran off the road, hit a curb, flipped over the handlebars and went into a guardrail, and shattered my face, broke my hip, severed my aorta and my vena cava, which
you were pretty busted up.
Yeah, it was pretty intense.
And you were in a coma for a month after that.
I was in a coma for a month, yeah.
Now, part of what happened was with your hand, which we see all bandaged up here. Tell me what happened there.
Well, what happened there? They put me on these things called pressors. So when you're going through a trauma, they have to divert your blood from your outer extremities to your more important organs like your heart and your liver to keep you alive. And as a result, a couple of my fingers turned necrotic.
Okay.
And they had to amputate my thumb and the tip of my index finger.
But they managed to get you a thumb of sorts back.
They did. So what these guys did were
were they amazing doctors here in Maryland? Because you had to leave California to come here. What did you all do for him? Because I'm seeing thumb.
Yeah, so Brandon lost his thumb and part of his index finger, like he said, and he had a lot of scarring in the hand. We had to figure out the best way to give him the most functional hand possible. And we used a traditional method of thumb reconstruction called a policization, where we can take an injured, shortened index finger and bring it over to the thumb position and make a new thumb out of it.
And you all are the best in the country to do that? Is that why he came here to us?
Well, we like to think that we're very well trained and can offer a whole host of reconstructive options.
Now, why so important to have, I mean, I can guess, but why so important to have the thumb?
Having a finger out of the plane of the other fingers allows you to open up a whole world of functionality of the hand that you may not otherwise have without a thumb.
You don't think about that because you got to hold, you got to pick up. I mean, you don't think about that on a, daily because we're so used to having that. You talked about how many surgeries on your hand?
Well, this is the second one I just had last Thursday, but...
And how many surgeries overall?
Oh, I've had probably over 20 at this point. I don't even know.
With his hand, what kind of functionality will he have going forward?
We expect a tremendous amount of functionality that he didn't have before. He had a lot of scarring between his thumb amputation stump and his index finger. We were able to open that up, bring the index finger to the thumb position, and recently he underwent a surgery to get the rest of his fingers up out of his hand, so he should now be able to grasp and manipulate objects and do most activities of daily living that he would like to do. And
so he's done. He can go home to California and get back to as normal living as you possibly can.
Oh, yeah.
And living, period.
It is. It's amazing. It's like science fiction. It's absolutely amazing.
That is awesome.
Yeah.
And if people recognize your face, it's because they did all the stories about how you thanked all the donors. How much blood did you get?
I got 207 units of blood, which it's actually 207 pints, which is 26 gallons.
Which is a lot of people that had to contribute
196 people, yeah. It's absolutely amazing.
And these were all strangers. I mean, they just came to help a man in need.
High school kids, all ages. It was absolutely amazing.
That's pretty awesome. Well, we thank you for coming and sharing your story. We thank you for what you do that can help somebody like that and get back to a normal life. All right, well, coming up, we have a warm-up.